Well, thank you very much indeed, Caroline, for that great speech and for your introduction. It's a great privilege of mine to be with you here today for the first time since I became Cabinet Secretary for Health and Social Care, and I hope to attend many more of these sessions in the future. And I need to be honest with you all at the outset of this contribution. I'm normally asked, mostly by my kids, whether I'm getting nervous about making speeches, whether about speaking in public. And normally, not so much. Did the speech in Parliament last week, ready for a heckle coming back and forward. I hope there aren't too many this morning. But today I am, because you are my folk. You are the people that really matter to me, and your views really matter. And it also matters to me that we're getting it right in government for all of you. So today I am a little bit nervous for the first time in it feels a long time in making a contribution from a lectern. And that's because of the importance and the value that I place on all of you and events like this, the importance of the work that you do. So it's one of my great honours in my role to be getting to meet, to work and to talk with all of you in the visits that I do. I know from my own experience and from my ministerial visits so far that Scotland is a better place for having such caring, dedicated, skilled, passionate colleagues across its health and social care services. We're lucky to have you, and that is why we will continue to invest in you and your colleagues. The NHS is an institution that we all cherish, we will all fight for and support. We depend on it, we depend on you from our first moments on this earth to our last. But it is precious and important not only because of its history or its importance to our society or how closely we hold it dear to its founding principles. It is precious because of the care that you provide for the people of Scotland. Dr. Victor Montori, who is a professor of medicine in the States, recently spoke at the Realistic Medicine Conference here in Glasgow, and he talks about care not just being a job, but being a practice and a disposition, and that healthcare without care is simply not sustainable. So I know all of you care very deeply about the people we serve, but also about the NHS as a beloved system of care. And I speak to you here today at an important and critical time in how we approach our nation's health. Caroline touched on this very well. We have reached a critical point in our nation's health. You will know more than most, and the facts are stark. As I outlined to Parliament last week, health inequalities are stubbornly persisting. More people in our country have greater dependency on long-term health interventions for preventable disease, and life expectancy is stalling. This both reduces the well-being of Scotland, our ability to be collectively productive as a country, and it impacts the long-term sustainability of all of our services. So let me be clear, the NHS in Scotland and the values that underpin its work is an institution of national pride, and I will always protect that as your Health Secretary. And I also recognise the absolutely vital role of our social care systems in supporting people to manage their care needs within their communities. The principles of a health service for everyone, owned by the people and free at the point of delivery, for me, are absolutely sacrosanct. And as I made clear to my political colleagues last week, any consideration of abandoning those fundamental principles, those fundamental values, are red lines we simply will not cross. So while those principles will not change, Scotland itself has changed. The NHS was established to address the health challenges of its time. We now live in different times. We have all endured a global pandemic and its impact remains. You will still be feeling that every day of your service. And the world has also changed. And compared to the year that the NHS was formed, our life expectations are different. The medicines that we can use are much more. Technology is transforming the way we live, and lifestyles have also changed. And as you all know, the treatment of people in hospitals when they are ill is only a small part of a modern and effective healthcare system. Hospital care remains a vital part of providing critical and specialist care, and we need our network of hospitals to be there for people when they need it most. But there is so much more to the services we provide and more considerations to be made of our work beyond the walls of our hospitals. Care is provided in our community spaces, between primary care services, community health and social care. And we must also not forget that NHS care is also more than our physical health. It is also our mental health and seeing the people we care for in a holistic way. So it is within this landscape that the sustainability of our healthcare system services are facing unprecedented pressure. Our desire for reform and improvement in this situation is driven by an overarching vision which will guide our work. This vision will be behind every action we take to reform and improve our health and social care services. It is one with which I would believe no one here would argue. A Scotland where people live longer, healthier and fulfilling lives. It is underpinned by 4 fundamental key areas of work: improving population health, preventing ill health, improving quality services, maximising access with a due consideration for the people at the heart of our services. In the short term, we're ensuring that our services are delivered in a way that epitomises our current arrangements. And in the medium term, we need to begin to transform how we work to deliver for people and across services. But we must also look to the future, because in the longer term, we need to fundamentally change how we think about the delivery of health and social care, driving investment in prevention and early intervention. Our vision also reveals the complexity of the task before us, because without improving our nation's general health, no end of service improvements will be able to make us a healthier nation in the long run. And as Caroline mentioned, the First Minister has already set out his overarching priorities for government: eradicating child poverty, tackling the climate emergency, driving growth in the economy and improving public services. I want to collaborate with all of you in the reforms and improvements that we want to bring to the health services in this country. We cannot realise our ambitious vision alone. So I'm fully committed to a series of national engagements which will inform our plans to improve our contribution to public services. We've already spoken to nurses and midwives across the country through in-person engagement events held in every health board area across Scotland, virtual groups and online surveys. We have managed to hear directly from these staff about the issues and challenges they face and will help shape the recommendations of the Nursing and Midwifery Task Force, amongst other groups. We have also established a primary and community health steering group, bringing together a range of stakeholders and partners with interest in the strategic reform of primary care and community health services. This will help to collaboratively develop a route map to further enhance the sustainability of primary care, aligned to a wider reform of health and social care. A new expert reference group will be convened this autumn, providing independent advice, experience and an international perspective to draw on the best of global health. And a stakeholder advisory group will also bring together a cross-section of service leaders, professional associations, COSLA, service delivery regulators and the Alliance, so we make sure we root our reforms in the needs of those who use our services. And I look forward to hearing directly from system leaders as we look to translate the vision we have into delivery across the system. In addition, I want to give you, the workforce, at the heart of our services, the voice that you deserve. We'll listen to those voices and we'll act upon them. And by the end of the year, we'll have brought them to bear on the actions we will take. You, our healthcare workers, a key part, an absolutely crucial part of this vision for reform and improvement. And as you will know, in addition to the ongoing implementation of Agenda for Change, we're working with the BMA on junior doctor contract reform as well. The Health and Care Staffing Scotland Act 2019, which commenced in April, is the first comprehensive multidisciplinary workforce planning legislation in Scotland and the most comprehensive of its kind in the UK. we have launched the new Ministerial Task Force on Nursing and Midwifery with a broad remit covering attraction, education, training, retention and staff wellbeing. However, we know that the NHS is more than doctors and nurses, as important, crucial that they are. There are more than 13,900 allied health professionals, the people across patient services, administration and management, to name just a few. All are essential to our delivery of care. And we've recognised the vital role of the social care workforce with a pay uplift to £12 per hour for adult social care workers in commissioned services. My commitment today to our NHS workforce is that we will continue to value you in the way that you deserve. And I'm aware that there is much national and parliamentary focus, rightly, on reducing waiting times, unblocking delayed discharge, improving the overall performance of our current systems. And this government is absolutely committed to addressing those challenges. But I'm also aware that often when we speak of this work, there is less attention paid publicly to the well-being of our staff, who actually have to enact the changes that are required by us, and the well-being of the staff who do the work. But I'm here to say that your well-being is absolutely the heart of our thinking and our policies. And I personally recognise that throughout your careers, as in all walks of life, you will sometimes face overwhelming demands on your time and your energies at home as well as at your work. So I'm pleased that the Scottish Government has developed national workforce policies to develop and provide a range of flexible working options to help you balance your work and home life whilst maintaining and promoting the best possible service to our patients and service users. These policies include the NHS Scotland Flexible Work Location and the NHS Scotland Flexible Work Pattern Policy. But I know there is more work to be done to make sure a better work-life balance is not just an aspiration, but a reality. The National Workforce Strategy for Health and Social Care in Scotland made it clear that the well-being of our health and social care and social workforce, wherever you work, will continue to be a priority. And after this current general election period is over, the Scottish Government will publish Improving Wellbeing and Working Cultures, which sets out our vision to enhance working cultures through programmes of work at a national level that focus on the three pillars of wellbeing, leadership and equality. Because creating a sustainable health service is fundamentally linked with developing a positive working environment for our workforce. And I'm acutely aware that without a due care taken to the need to improve workforce culture and morale, the delivery of reform and improved services, processes, the models of care and innovative technologies just cannot be fully implemented. And part of that well-being must also be about your career progression and improved practice development. I know there are colleagues within the room that have been on the skill course. There are graduates in the room, and my wife is not here, but she is included. She is a graduate of that skill programme that focuses on the improvement of practice, of which you are supporting our workforce to deliver improvement. And that type of support for our workforce in your careers is crucial to a sustainable workforce with improved culture and well-being. The delivery of improving well-being and working cultures will also support the economic well-being of the workforce, greatly contributing to the mission of improving public services, creating positive outcomes for both staff and service users. And this is important because the demographic challenges facing Scotland is real. And we have to be able to adjust our own work and structures to meet it. Extensive work has already taken place to develop workforce demand projections for health and social care, including engagement with stakeholders to understand the different user needs. And early considerations and conclusions indicate that further workforce growth will be required between now and 2030 across the entire health and social care workforce to successfully respond to the known demographic trends within Scotland's population. There are also external challenges. We know that through data released by the Home Office that health and social care worker visa applications are down by 76% in the first 4 months of this year compared with the equivalent period in 2023. International workers play a deeply important role in our health and social care services. To see them choose not to come here or to have barriers put in their place to come here is deeply worrying. We need to be able to take any and all necessary steps to attract and retain hard-working people in Scotland to work in our health service. Because, as you know, the workforce of NHS Scotland is large. It's employing over 180,000 whole-time equivalent staff. And whilst our NHS workforce has seen 12 consecutive years of growth, we know that growing the workforce alone does not ensure improved performance or patient safety and experience. It is through reform. It is through improvement and diversification that we can progressively make better use of our workforce and improve the design of our services. So alongside our workforce, we need the right tools, the right technology and infrastructure. And I know that in one of today's plenaries, you will be discussing a focus on digital and how technology is and will be supporting our reform agenda. And I urge you to participate in that discussion. And as we continue this work to reform our health and care services, we will continue to improve recruitment both in and to rural and island areas. We're engaging with employers and partners across the health and social care sectors in the development of our rural and islands workforce recruitment strategy. We aim to support employers to ensure that health and social care needs of the people who live in our rural and island communities are met. As I said at the beginning, Scotland is lucky to have you working for the health of our nation. So I'm very happy to announce that today nominations for Scotland's Health Awards 2024, which are being delivered in partnership with the Scotsman for the first time, are now open. They celebrate the extraordinary achievements of those individuals and teams who go above and beyond to deliver compassionate, high-quality health and social care to the people of Scotland. The awards recognise the contribution of frontline health and care workers, but also celebrate those who work so hard behind the scenes to support those, to ensure that we have the kind of health and care services that are vital in achieving the highest quality of care. The nominations are open today, so please take the time to nominate from the 16 award categories for this year, and you can find more information on the NHS Event app. Colleagues, you will be aware that some of my colleagues in Parliament and outside the Chamber have called for fundamental structural changes to the NHS in Scotland. At present, our reform vision is focused on service reform. This includes actions like a laser focus on delayed discharge. The First Minister has taken a personal interest in those delays, in delayed discharge, and has asked me to undertake a mission to reduce delayed discharge. This mission recognises that behind every statistic is a person who will not sleep in their own bed tonight and who has been put at risk by being kept in hospital for too long, longer than is clinically necessary. There is a significant variation across the country, and every one of us has a statutory duty and a moral responsibility to improve that situation, those outcomes for our patients. We cannot fall into the trap of seeing this as a social care problem. It will require a whole system response, with our NHS working closely with our health and social care partnerships and local authority partners as well, and indeed our independent and third sector partners. And in the future, we may indeed consider structural changes. They may be necessary as we continue to reform and improve, but given the urgency of the change required, the current focus must be on the transformation of services within the current structures and maximising the current assets. We know that parts of the system are facing additional specific issues, for example in primary care, with increased complexity of patient needs. In addition, representations made strongly and repeatedly by professional bodies highlight increasing demand resulting from pressures elsewhere in the NHS system, such as secondary care waiting times and shifting public expectations. We are not looking to publish a new strategy. My focus is on delivery, building on the foundations already developed over the past decade or so. To do this, we work to implement an NHS Scotland approach, to harness greater levels of collaboration in our health boards and partners, between our health boards and our partners, resulting in better value, quality, and crucially, outcomes for patients and staff. Through all this change, we must not lose sight of fundamental missions of healthcare, addressing the needs of each person. Taking a person-centred approach is also absolutely essential to NHS reform and improvement, and is one of the most important drivers essential to genuine reform. That is why we're working to embed a getting it right for everyone approach across all of our health and social care services, ensuring a joined-up approach to care throughout a person's life and placing the person at the centre of the decision-making that affects them. I now want to personally move from speaking at this NHS event to listening to and answering questions. Before I do, I want to thank you all again for your work, for your service, and for being the beating heart of Scotland's health services, so cherished by the people of Scotland. Thank you for inviting me to the NHS event today, and thank you again for all your hard work.
Thanks. Neil Gray, Cabinet Secretary. Take a seat. We've got a few minutes to take some questions. And just to remind you that we're going to have a little bit of Slido interaction during this, just in case you thought you were going to get away without audience participation. So thank you very much for taking questions. We asked for questions to be submitted in advance, and they've been integrated into the questions I'm going to ask you so that we observe individual privacies. So delegates were asked to submit questions, but I'm going to start with one from me, Neil Gray, which
That's a daunting start.
In February, Audit Scotland called for a clear national vision for health and social care in Scotland, saying it's really hard for health boards to plan in the absence of that. There was a debate last week in the Scottish Parliament that you led. Are we any closer to a clear national vision as a result of that debate?
I hope so. And I set out some of what my vision is for health and social care services. It's about making sure that we're getting people the right care in the right place at the right time from the right person, making sure that we're allowing people to live healthy and fulfilling lives. I'm not wanting to deliver another strategy document. I'm wanting us to be able to deliver upon what is already in the system, not least the 2016 National Clinical Strategy. I think that if we can deliver better on what we have available to us, underpinned by the vision that I've set out, including my contribution here and I did last week, then I think that gives us the driving focus that we need to see continued reform. Now, reform for me is not a fig leaf for reduction in capacity or cuts. It cannot be. It has to be about maintaining and increasing capacity, doing better with the resources that we have available to us. But critical for me, Penny, to reform is improvement, and how we drive continuous improvement into our service, which is absolutely fundamental as we recover from the pandemic.
Now, a key announcement that you've made is the national engagement. Tell me about briefly, what's that going to involve? Who's it going to involve? And what's going to be different about it from any previous engagement?
So this is about making sure that we're capturing the ideas, the concerns, and the processes that will help us deliver on reform and improvement. So for me, it's everybody in this room. It's everybody beyond that works in the NHS, but also those partners that help to deliver services, whether that's in the public sector, the private sector, the community and voluntary sector, as well as patients. So making sure we capture those voices. I don't want it to be a big national consultation in the sense that you get from the process of delivering legislation, because I don't want this to be too big and cumbersome. I want it to be focused so that we can have clear ideas for delivery and do so in a timely way, happen as fast as possible, because you all know, as I do, because I see the statistics I get to hear directly from staff and patients, the pressures that there are in the system. We need to have that improvement and reform happening as quickly as possible. And that's what I'm committed to doing as your health secretary.
Okay, now, what I don't know is what timescale you're talking here, but it's going to be really important that you get the support of both the NHS, social care, third sector services to gather the widest a view of the system and critically ideas for, supporting its improvement.
Yep.
What would you say to the people in this room and outside it, because I hope there's a lot of tweeting going on to share some of this, about joining in with that?
So there will be further plans set out as to how colleagues can engage with that, but my door is always open. Everybody will know how to get in touch with me if there are areas or suggestions that they wish to contribute, but we'll have more formalised structures that are coming through as well. In terms of the timescale, I set out in the contribution there that we're looking to come forward with a package based on what we have heard by the end of this year. Okay. So that is, that I hope sets out to colleagues the pace that I'm wanting to inject into this. We cannot afford to wait. Okay. We have to move on.
We've got 6 months then. I'm going to go to our first Slido poll question, which is basically to take the temperature in this room. Okay. And I wonder whether we've got that first question up there now. Going to ask you in this room to use your Slido, if you would please, and answer this question, or respond to this. I would be happy to get involved with the national engagement. So that's you as team leaders, as individuals on teams, as patients and carers. Would you say yes, no, don't know, or need to know more? Well, I think you've got an overwhelming endorsement of support there, Neil Gray.
Well, it depends on what those contributions are, but it's very good to hear that people are at least willing to be engaging. So that's what I'm
All
after.
Contributions are good.
All contributions are welcome. All contributions are welcome.
Will it come with a budget?
Yes, we've already invested beyond the resources that we have received from Westminster. Colleagues know the crucial interdependence that there is between decisions that are taken at Westminster and the financial resources that we have here in Scotland. So the block grant has been reduced, and yet we have taken decisions around, because the funding available to the NHS in England has gone down, but what we have chosen to do is have a more progressive form of taxation. Now, for some of the colleagues, that means you will be paying more tax than you would do if you were working elsewhere in the UK. But what that means is we've got £1.5 billion more to invest in public services than we would have done otherwise. And that's why, if I can be political for a second, this election is absolutely critical, because the debate of ideas around continued austerity, or as I want to see, an end to austerity, is about making sure that we continue to protect our public services. Fundamental to that is our NHS.
Okay.
And if we have decisions taken at Westminster to invest in our health services, that allows us to do
Will
that.
this engagement exercise come with a budget? If we're asking the whole room and everybody behind them and in front of them and around them to get involved in this, does it come with cash?
Well, the engagement itself, of course, because we have to have that engagement work, and the structures that will come alongside that have to be funded. So, of course, yes. And beyond that, the ideas that come through, for which I'm very much looking forward to the significant engagement to come from colleagues in this room and beyond, the ideas that come from that, of course, we will look at all of those and do what we can to implement as many as possible, because I want to see an improvement, and it has to come with a budget.
We've got a fantastic 80%, absolutely happy to get involved. We've got 20% wanting to know more. When are they going to know more?
We'll be publishing more detail. We've got, again, the election means that some announcements have got to be curtailed, but we'll have more information coming through post-election.
Now, I heard you reference, the extreme pressure on the workforce and the work that you're doing. We haven't had junior doctor strikes, for instance, in Scotland, but we are still finding it incredibly hard, for instance, to staff the social care, the third sector care that's keeping people well in their communities. What can we do about that?
So the first point I want to make there, Penny, is that I don't take those industrial relations in Scotland for granted, because we can see the challenges that there are in the NHS in England and in the NHS in Wales because of the strike action, the impact that has had on their recovery. I don't want to see that in Scotland. I want to see continued good industrial relations, but it is challenging, and it's going to be increasingly challenging this year because the financial situation is so stark. But I don't take that for granted. The workforce is absolutely critical, and I understand, because I come into settings, into hospitals, GP practices, social care settings, so I can see the pressure that there is on the system. My father had a hip operation on his 80th birthday a couple of weeks ago, and I was seeing, as a family member, how incredibly well he was treated and how incredibly well that procedure went, but also to see the pressures that there are.
Yeah.
It's not the same, the pressure is not the same in every area, it's not the same in every discipline, it's not the same in every site. For some people, that pressure will be very different, as it will be the experience of patients, because people keep on talking about an NHS crisis, and I don't think that's helpful. I think we have to recognise where there are challenges, but what we have to do is make sure and be realistic about those challenges, but we also have to talk up the incredible work that all of you do, colleagues across our NHS do, for patients across the country. Because for the vast majority of people, they receive an incredible service on time, within the time that would be expected. And I think it does you no service in continually talking about a crisis in our health service, because for the majority of people that is not the case.
Well, what's going to be very interesting then through the national engagement is the breadth of ideas that you might get for reform. Here's the question that's going to the audience. What is the top priority for reform for you in this room? We're seeing these words coming up and being highlighted, obviously, words like sustainability, digital infrastructure, and I think we heard, you know, from both Caroline and yourself about investment in that.
Yeah, and I can see in there funding, money, sustainability. That's why reform and improvement is so important. Prevention is absolutely
putting money
critical.
into public health. You know, when you've been a BBC reporter and a producer, you know what grabs the headlines, and it's less likely to be the social care elements of the service and the delayed discharge, well, actually delayed discharges are up there, than the blue lights. You know, are you going to can be able to continue to invest in the prevention that's going to bear fruit long beyond political terms?
So the challenge, I made this point last week to the Conservative spokesperson, Sandesh Gulhani, because we're in agreement, I think we're in agreement across the political divides, that investment in prevention, primary care and public health are absolutely critical for our future sustainability of the health service. You all know that. You are all wanting to make sure that we're preventing worsening health, that we're addressing people's healthcare needs as early as possible. The challenge that we've got, and again, colleagues in the room will know this, is the pressure on secondary care services are so stark as well, and we only have a limited budget from which to operate within. So the big challenge and the cranial application that I need to apply, that colleagues in this room, I hope, will be able to come up with ideas around, is how we are able to shift that resource that I want to see into primary care and prevention without seeing secondary care services failing, falling over, or not meeting the needs of people right now. Because yes, if we can get primary care and prevention work happening, we see health, critically, health savings, but also financial savings in secondary care, but they don't happen concurrently. They don't happen at the same time. We need to see an investment that comes before the improvement that we'll see.
There's so many questions.
That is the challenge that we've got.
So many questions to put to you, because we could talk about mental health, we could talk about cancer care, both areas that we've had specific questions on. Unfortunately, we won't have time to get into the detail of that, but I'm hearing from both our speakers this morning, digital, the infrastructure, the digital support that can be given to this subject is really important. Yes, we have some fantastic innovations, remote surgery, robotics, etc. But I hear from pharmacists that still can't access the whole patient record, for instance. How quickly can we sort that kind of thing out? Because I'm told it's a bottleneck in the system.
We need it to happen faster. Improvements around digital and sharing of data is something that is a priority for us. Again, I go back to one of the the words there up on the graph was around funding. One of the challenges that we've got is around capital funding, and it's capital funding, infrastructure funding that funds improvements in digital and data. And colleagues will all be aware of the capital funding pressures that we have.
National treatment centres, etc.
Exactly. But all of these projects that have had to be paused, I know that they need to be happening for the continued improvement of our health services, for the continued recovery, for the recruitment and retention of staff, for the efficient use of our NHS. And that's why the review of capital across government is so important. We try to release as much as we can from other portfolios in order to invest in the health service.
So is there potential then for that being reinvested?
That's what I want to see. That's what I want to see. Obviously, the Finance Secretary is needing to carry out that review of capital projects across government. I'm fighting as hard as I can to see as many of the projects that you will all be aware of in your own areas, so, health centres, hospitals, investments in projects like the digital front door, making sure that we're actually providing an efficient and productive health service. I'll be fighting for that, but again, the decisions that are taken elsewhere have a material impact on that. And that's why it's so important that we have a Westminster government that comes in that doesn't just continue Tory austerity, but actually invest in our public services. That's what I'll be fighting.
Okay,
battering
end of
down
party
the door.
political broadcast.
I'll be battering down the door to those down.
Go to our last Slido poll of this audience, which is basically asking you out there. The title of this year's conference is Planning for the Future, delivering health and care services through innovation and collaboration. Just a wee sense check here. Is that positively promoted where you work? And I'm hearing that, in 82% of cases it is. But do you know what? Again, in about 20%, people either don't know or it's no. What can you as Cabinet Secretary do to shift that?
Well, I'm really pleased that so many, 4/5 of the audience believe that there is that innovation and collaboration, that culture of innovation and collaboration within your workplaces to ensure that we see that continued development, because it is absolutely fundamental.
But what can you do about the 20%?
So the other elements is a continued engagement with our board chiefs and chairs, making sure that they are as bought in as I am to the need for that innovation and collaboration. And it's critical that we get this distinction between the debate that there is around the role of private healthcare and what I want to see, which is different, which is the innovation and technology that comes through the academic sector and the private sector, embraced by the health service, so that we can see more capacity for our staff and clinicians to be able to do the caring work that I've spoken about, making sure that it's about enhancing service, but making sure that we're driving that through all that we do. So ANIA is so important, making sure that the implementation of it across our healthcare systems is critical. But again, that is why your voice is so important to me around where you're seeing that working well, where you're not seeing it working well. I need to hear that so that I can make sure that we're focused in on delivery, and I can get access, I can get to that 20% that feel that they don't know, or they would say no to that innovation and collaboration being actually promoted.
Oh, I wish we had so much longer for this conversation, because I've got so many more questions to ask you. But I'm going to close with a final question. You know, we've heard in recent times RCN Scotland, for instance, referring to a national patient emergency. We hear about long waiting lists, delayed discharges, all the stuff that us as journalists, you as politicians, you as service providers are well aware of. Are you confident, Cabinet Secretary, that together we can make a positive difference and quickly enough?
Yes, you're already doing that. You're transforming people's lives, saving people's lives, and helping them live better lives. But we also know that for too many people, they are waiting for too long. That's why the investments that Caroline spoke about in terms of taking down waiting times are so important. It's why the reform and improvement work and your engagement within it is so important, because I want us to be able to deliver continued improvement. I want us to be able to deliver a continued recovery from the pandemic, not just for our patients. That is absolutely fundamental. It's why we're all in the jobs that we're in, but also for you, because I understand the challenge that there is when you're referring into a treatment pathway that has a long waiting times and how disempowering that is. I know that when patients are arriving with you and they've waited for too long, the frustration and also the health, the worsening of their health in that time is not what you want either. That's why we need to continue to see improvements on the system, the way that it works. The investment that we're making, I hope, will make that difference. And I'll keep working with you to see those ideas come through to fruition.
And we're going to be able to hold you to account on
Absolutely. Well, there's an election in 2 years' time.
OK. Thank you so much, Cabinet Secretary.
Thank you.
And thank you so much, Caroline Lamb, for that. What a great start to the day. Would you please join me in a wonderful round of applause for our opening speakers? Thank you. Thank you.
Thank you.